How do you change intractable schema-driven behaviors in CBT? Imagine trying to change a habit that feels like part of who you are. Sometimes, behaviors rooted in deep beliefs seem impossible to shift. That's when understanding how to work with schemas becomes essential. In cognitive behavioral therapy, especially in the advanced models like schema-focused cognitive behavioral therapy, the goal is to target these long-standing patterns. These patterns, called schemas, are broad mental frameworks formed early in life. They shape how you see yourself, others, and the world. These schemas influence your reactions, feelings, and behaviors, often leading to persistent problems. The first step is to identify and assess these schemas. Therapists use interviews, questionnaires, and observe behavior to find out which schemas are active. For example, someone might have a schema of emotional deprivation, believing their emotional needs will never be met. Once these schemas are clear, the next step is to challenge them. Cognitive techniques come into play here. The therapist helps you examine the evidence for and against your schemas. You look at past experiences critically, questioning whether your beliefs are accurate or distorted. For example, if you believe you are unlovable, you explore whether specific events truly support that idea or if there are exceptions. This process helps weaken the schema's hold. But changing schemas isn't just about thinking differently. Emotional work is equally important. Techniques like imagery exercises or role-playing allow you to access and process the feelings tied to these schemas. For example, imagining a comforting scene can help soothe feelings of abandonment. This emotional work helps rebuild trust and safety inside yourself. Behavioral change is also vital. Clients are encouraged to test new ways of acting that contradict their schemas. If someone has a schema of helplessness, they might practice making decisions or taking small risks. These actions reinforce healthier beliefs and behaviors over time. Another key element is schema mode work. This involves recognizing when you're operating in a maladaptive mode, like the vulnerable child or angry protector. Learning to shift into healthier modes helps you respond differently to triggers. Sometimes, involving loved ones in therapy can help. For example, couples or family sessions can address relational patterns that support schemas. This creates a supportive environment for change. Mindfulness and self-compassion are also used to increase awareness and reduce emotional reactivity. These practices help you observe your thoughts and feelings without judgment, making it easier to choose new responses. Ultimately, changing intractable schema-driven behaviors takes time and consistent effort. The process involves challenging and reshaping core beliefs, addressing emotional needs, and practicing new behaviors. Over time, these efforts weaken the power of old schemas and build healthier ways of thinking, feeling, and acting. In schema-focused cognitive behavioral therapy, this comprehensive approach is designed to help you heal long-standing patterns that seem resistant to change. It's about rewiring your mental and emotional responses so you can live more freely and authentically.